Hi, I'm Genia. I'm a nursing student at Nevada State College, and I have my professor Rachel Sarayan, but right now I'm with Mitzi Flores, and I am interested in checking off my medical administration. I'm unable to do that in person because of the coronavirus, so I'm attempting to do it at my home. Okay, so I'm going to start now. It would be, say, 7:30 in the morning. And I have arrived at the MAR, and I am with my patient's information. The provider has given me his prescriptions. My patient's name is Bruce Wayne. His birth date is February 19th, 1965, and he has no known drug allergies. The physician has ordered him these medications: metoprolol, Colace, Lasix, Rocephin, Humulin, NPH, PPD, and regular insulin. In order for me to make sure that I know which medications I can give him, I have to look at his vital signs, okay? So his blood pressure today is 160/90. I'm looking at metoprolol here. That is a medication for heart, blood pressure, and pulse. It should be given to him because he has a significantly high blood pressure. 160/90. Now, if it was less than 60 pulse, I would hold it. Okay, the Colace is a medication given to Mr. Wayne because his stool, he is constipated. So that is a stool softener, and I'm going to need 100 milligrams by mouth. Metoprolol, I'm going to also need 100 milligrams by mouth. All right, so I'm good. I'm going to go ahead and take a pencil, and I'm going to check that I can give metoprolol and I can give Colace. Third medication is Lasix. I know that that's a diuretic. I know it's important for me to make sure that I look at the blood pressure, and it needs to be high enough to be able to give, which is 160/90 is fine. And also I'm looking at potassium, and his potassium is 5.2 today. So that's quite high as well, and that will be fine for me to give the Lasix diuretic. I'm going to need 20 milligrams. Then I have my Rocephin. Mr. Wayne, like I said, has no known drug allergies. He does have an infection, and so he's going to need that intramuscular injection of Rocephin, which is an antibiotic. I'm going to need 1 gram, 2 milliliters. Okay, and then I'm going to take my Humulin NPH and consider that with the blood glucose. Mr. Wayne has 159 blood glucose today, and so that is fine to give him. I know that that Humulin NPH is an intermediate acting insulin, and it will be given to him 46 units, and it will help regulate his glucose. Then the PPD is the next injection I'll be giving him, and that is going to be fine to give him because he has no known drug allergies. That's the medication I'm going to give him to test for tuberculosis. I'm going to need 0.1 milliliters. And then I have my regular insulin. Again, blood glucose is 159 today. So I'm going to go down to my sliding scale, and I'm going to see that 151 to 200 gives 2 units. So I'm going to say I need to give him 2 units. So now I have my medications, and I've checked this over. I'm going to start at the MAR, and I'm going to log in. STUDENT, and the password is STUDENT1. I'm going to press OK, and now I'm going to put in my patient's name, Bruce Wayne, Wayne Bruce, and I'm going to look at the medications that I need. Metoprolol is the first one, and I'm going to go ahead and select that. It comes in 50 milligrams pills, so I'm going to take 2 of those. Boom. Next thing I'm going to do is Colace. I need 100 milligrams, and I'm checking here, and I've got 100 milligrams. I have 50 milligrams each, so I'll take 2 of those. And then I'm going to look at my Lasix, my Docusate. I'm going to need 20 milligrams, and it comes 20 milligrams, so I'm going to go ahead and select that, 1 of those. So 2 metoprolol, 2 Colace, 1 Lasix, and then the Rocephin, 1 gram, 2 milliliters. I see that we have 1 gram, 2 milliliters here, and I can select that, boom. Next one is Humulin NPH, and I see Humulin NPH, and it comes in 100 units, so I'm going to go ahead and choose the 100 units. That's all I need because I'm going to use 46. Then I have the PPD, 0.1 milliliters, 0.1 milliliters. I'll go ahead and select that. And then my regular insulin comes in 100 units, and I only need 2 units, but I'll select regular insulin 100 units. So I'm good now. I've selected all my medications. I'm going to go ahead and push the button and open the drawer and get them out of the drawers. Okay, so metoprolol, again, 100 milligrams, and I need, it comes in 50, so I'm going to take 2, and I'm going to scan, boop, scan, boop, boop, and I'm going to set those aside. And I see that before I scan, of course, 2022 is the expiration date. So I have verified that that is the right medication, the right dose, it's not expired, and it's for the right patient. Colace is the next one I'm looking at, 100 milligrams, and I'm going to select 2. I've got those out of the drawer, and I'm going to look at those, and they are not expired, so I will boop, boop, go ahead and scan those. 50 milligram, and I have 100 milligrams. So I'll set those aside. Close up that drawer. Next one is my Lasix. I need 20 milligrams, and I have opened the drawer. I've got 20 milligrams Lasix, and it's not expired till 2022, so I'll select that. Okay, now that I have my by mouth medications, I'm going to go ahead and get my Rosefin and open that drawer. And Rosefin is ceftriaxone, so I'm going to select that, boop, and I see that is 1 gram 2 milliliters, 1 gram 2 milliliters, expiration 2022. I'm good. Close that drawer up. Humulin NPH, 100 units. I need 46 units. Expires 2022. Boop. There's nothing wrong with this packaging. I am happy with that. No cloudiness or anything with the medication. And then I have regular insulin is next. Sorry, PPD is next. And the drawer opens up, PPD, and I have 0.1, 0.1. And I will scan that, boop, and the expiration is 2022. Keep that. And then finally, open the drawer. I've got my regular insulin, 100 units, expires 2022. Go ahead and boop, scan that. Now that I have all my medications, I'm going to close up my drawer, gone over everything. I'm going to log out, boop, log out. Okay? Now, I'm going to get my supplies here, and I'm going to need, let's see, for my metoprolol, I'm going to take some, a little thing here. Normally I would take individual little ones, but I don't have those, so I'm going to take one big one to put all my pills in. And again, I'm checking this now to make sure I have the right dose, right meds, all that. Here we go. Metoprolol 50-50, and then I have my Colace 50-50, and then I have my Lasix 20. And I'm good. Those are all there. And then I'm going to need a Rosefin. Okay, so with Rosefin, it's an intramuscular medication, so I know that I'm going to need at least a 1 to 5 milliliter syringe. And I have a 3 milliliter syringe right here. It's a blunt tip, so I would take that, and then I would take a 22 gauge needle. And I know also that I could use anywhere between 19 and 22 gauges. Let's see, I would be using this medication depending on the patient's size and muscles, okay? So Mr. Wayne will be able to use 22 gauge, okay? So I have that. Next thing I have is my Humulin NPH. That one is going to be, I have an insulin syringe, okay, and it is a 29 gauge, 1/2 inch. It's 50 units, okay? And so now these syringes come in 30, 50, or 100. So happy for that because it's good to go. I don't need to do any needle switching. Okay, and then I have my PPD. Now with a PPD, I would use a 1 milliliter. Sometimes they do have the tuberculin syringe, but this is a 1 milliliter syringe. It's a Luer lock blunt, okay? So I would be able to use the blunt tip, and then I would change it, and I would go ahead and put in a 25 gauge, okay? This is gonna be a subdermal medication, so with that, I'll be fine to use the 25 gauge, okay? Again, now my final is the regular insulin, and I have a 50 unit again, insulin syringe, 25 gauge, that's a 1/2 inch long. So that'll do just fine, and I won't have to switch out the needles or anything like that. Okay, so now I have all my supplies. Okay, I'm gonna take that to my medication table where I will be preparing my things. Okay, so I'm gonna go ahead and prepare. Okay, I have my hand sanitizer. Putting on my hand sanitizer. And I'm gonna go ahead and put on some gloves. I'm in a nice clean area here in the quiet zone where nobody can disturb me. This is gonna be where I check my second med check. Okay, so my metoprolol, 100 milligrams, check that again. I've got them one, I've got two, so that's 50-50 makes 100. Colace, I've got 50-50 makes 100. Got those, the Lasix, I've got 20 milligrams. Again, I have Bruce Wayne, no drug allergies, and his vitals are giving me the right values that I can do this. And then I have my Rocephin, okay, and I'm going to take that first, and I'm going to draw up my Rocephin, okay. So my Rocephin is here. Oh, I need to move here. Shoot. Okay, I'm going to move here. And I'm going to take an alcohol swab. I only have one, so I have to be conservative. So I'm going to be rubbing this at least for 30 seconds and wait till it's dry, okay? I would do that for all of my medications. Now I'm going to take my 3 milliliter blunt, take it out, okay? And I'm going to, even though it's a blunt, I'm going to rainbow it. And I'm going to draw up, I need 1 gram per 2 mil, so I'm going to do 2 milliliters. Draw that up, get some air in there, and put it in the vial. Then I'm going to turn it upside down, and I'm going to draw up the medication, making sure that I prime and I don't have any air. Then I can take the blunt and put it up against the wall there, so that I don't hurt myself, and then I would throw that in the sharps, okay? So then I would put the 22 gauge on, and I would open that carefully, not to touch anything, and it would be ready to go, okay? So I'm gonna put this in my package, and I'm gonna label it Rocephin. The next one I'm gonna do the same thing with my alcohol. I'm gonna do my NPH, and I'm gonna swab, 30 seconds, and I'm going to take my insulin needle, and I'm going to take the lid off, rainbow it. I'm going to draw up NPH 46 units to 46 units, air, inject that, turn it upside down, draw up 46 units, make sure that I don't have any air bubbles. I'll pull it back a little bit farther to prime it, and then when I'm done with that, I'm going to have to put the cap back on carefully, okay? And then I will ask my instructor what they can verify with me to tell me what they say. So the instructor will say, yes, I see 46 units of NPH. And I'll go ahead and put that back in the wrapper and put NPH. Then I have my PPD, my Luer lock here. Unwrap that, take my alcohol, and I have my PPD, tuberculin. And I would rub, good 30 seconds. And I've got my, I'm going to rainbow it, take it off. and I'm going to draw 0.1. Then I'm going to inject air, and then I'm going to turn it upside down and draw another 0.1 back up with the liquid very slowly. Make sure I don't get any air bubbles. Okay, perfect. And I'm going to recap that, and then I'm going to change my needle so that I have a nice, clean, new needle 25 gauge, okay? So I do that, and I cap it, and I put it back. Okay? Then my final one is the regular insulin. Take this, clean it. I'm going to clean it for a good 30 seconds. Okay? And then I have my 50 unit. Okay, I would rainbow it. I'm going to hold on to the thing so it doesn't close it. And I'm going to pull up my 2 units. Just a few. There's only 2. Then I'm going to go ahead and put that air in there. After I've cleaned that good, draw it back up again. 2 units. Okay, I'm going to recap carefully against a surface so I do not poke myself. And then I'll take my regular and I'll be like, okay, Professor, could you please tell me to verify this? And I would do this also if I had heparin as a prescription. So, and the reason why I'm doing this is because insulin can kill someone. It can cause hypoglycemia. So my professor has verified 2 units of regular insulin. Put this back in, and I'm writing down my regular insulin. So I've got my PPD, I've got my regular insulin, and my NPH. Okay, now I'm done, and I'm going to leave this area, and then I'm going to go to the room, and I'm going to go ahead and educate my patient, okay? So, all right, take the gloves off, perform hand hygiene, get my belongings, and bring them to my patient's room. Okay? Now I'm going to stop the clock. Well, I don't have to, but I will.